Good morning everyone. I am Dr. Sandeep Janardhan Tandil. I am a general and laparoscopic surgeon. As we are discussing the various swellings in our body, today's swelling I have taken is a pyogenic granuloma. So what is pyogenic granuloma? Why it is called pyogenic granuloma? What are the different names associated with it? How patient will present? What are the investigations, treatment, and how to avoid it? So first we will discuss why it is called as a pyogenic granuloma. It is called pyogenic granuloma. The word pyogenic means infection, and granuloma it means a swelling which can occur following a infection or injury. Now in the past time when doctors were giving names to the different conditions, they thought this pyogenic granuloma, this swelling happened because of a injury and infection. That's why the name termed as a pyogenic granuloma. But actually now it is not considered as a only the cause. That infection and injury is not the only cause for formation of the pyogenic granuloma. So the current name, actual name, is a lobular capillary hemangioma. That means the swelling arising from the blood vessels. It is also called as a granuloma of the pregnancy. Why? We will discuss in our video. I also call it as a touch me not swelling, and why we will also discuss that. Now before going ahead, we will discuss what are the causes for formation of pyogenic granuloma. There are various causes for forming injury that trauma can cause. Infection with a staph aureus can cause in this. There are the medications, certain medicines like anti-HIV medicines, anti-cancer medicines can also cause this pyogenic granuloma. Even the retinoids, the medicines used for the treatment of the acne, can cause this pyogenic granuloma. And another cause is during pregnancy. Now during pregnancy these granulomas are common because of the hormonal effects. So that's why in pregnant women pyogenic granulomas are common. Why we call it as a pyogenic granuloma is as the name is been given in the past, and now people are just continuing to use the word. So that's why it is been used as a pyogenic granuloma. But ideally it is a lobular capillary hemangioma. So now we will discuss how it forms. So why the blood vessels come out of the body in one particular part and from the swelling. So this can happen in any part of your body, like from the skin to any part. It can happen in your mucous membrane like inside your mouth, oral cavity. It can happen inside the nose area also. So what happens if there is a infection or injury, or because of the drugs we have discussed, or hormonal factors? What happens is one particular part of our body has a capacity to grow the new blood vessels and even to control the formation of new blood vessels. So this growing and controlling is happens in various parts. So when there is an imbalance between this formation of new blood vessels and stopping the formation of new blood vessels, so any one particular spot, the body thinks that area, that formation of blood vessels is required, but our anti-formation doesn't come into effect. So the body keeps on forming new blood vessels which will come out from that area and form like a small swelling. This can look like a raspberry, the fruit, the red raspberry fruit. It will be like a reddish in color because these are the blood vessels which are filled with the blood. So the color of it is usually reddish in color. So what happens is there is a one single blood vessel which is coming out, and it is dividing into the multiple branches. Like you can imagine like a cauliflower which is having a single stem in the middle, and then it branches out and gives multiple small blobs like. So the one blood vessel will be there and it will be giving multiple branches out, and it forms a swelling in that area. That's how this swelling comes out, and then it appears reddish in color. So next thing what we'll discuss is how patient will present. Most of the time patient comes to the hospital to a doctor applying multiple bandages on that small swelling. Why? Is because to avoid injury, recurrent injury. The thing is this swelling is very friable and it bleeds. That's why I call it as a touch me not. Like whenever you touch, it bleeds. It bleeds, and then the bleeding stops in some time with the pressure in that area, but it can rebleed again. There might be a small swelling which is reddish in color like a raspberry. Then there might be a crust over that area. It might become dry and become the crusty. And most of the time, patient gets panic thinking that it is something very serious problem. And when bleeding happens, anybody gets panicked. So once again, we will quickly discuss how patient will present. Patient might notice a small swelling in a one particular area. That might be very small, like in a millimeter it will be, but it will rapidly grow over the period of weeks and months, and might become from millimeter into the centimeter. The second symptom, the patient will come with a bleeding. There will be profuse bleeding. Whenever there is a touch by accidentally or when you touch it, there will be a bleeding in that area. It will be in reddish in color. It might be having some crust over that area. Sometimes it might get infected. If it gets infected, it might become painful in that time. So now next thing, which age group is affected? Pyogenic granulomas or lobular capillary hemangiomas can happen in any age group, but common age group is the children and young adults. It happens in second decade mostly. Even adults get affected. Now which area gets affected in the lobular capillary hemangioma? In adults, mostly it is the trunk area, this part, and the extremities like hands and legs. In that, even the upper limb, the hand area are more commonly affected in adults. In children, it's mostly the face and the neck area. It can happen inside the oral cavity, on the lip, over the tongue. It can happen in the nose. So sometimes the children might pick the nose and it start bleeding, and then parents get panicked. Even inside the oral cavity while eating food, it might suddenly start bleeding, and the child or parent might get panicked. So that's how the patient can present. So next thing we will come to discuss is what investigations are done, how we diagnose. So when you present to the doctor, usually the patient, most of the time patient will place multiple bandages on that area. The doctor will gently open it and see the swelling. While opening also there is a chance it might bleed, but the swelling will be like from small millimeter to the centimeter in size. It will be like a fleshy swelling, like a cauliflower type. It might be looking like a small raspberry fruit type small, and it will be reddish in color. There will be some crust on that area, and mostly it's a clinical diagnosis. Doctor will diagnose based upon your history. If there is history, if you are giving history of the trauma on that area, you are taking medicines like anti-cancer treatment or anti-HIV treatment or retinoids for the acne medicines. If your patient is pregnant, during pregnancy it is common, so doctor might think about this swelling. The investigations which you can expect is sometimes doctor might ask you the sonography. Sonography is to know the vascularity, like it is called as a Doppler sonography, to see how many blood vessels and how deep it is, to know that. Dermoscopy is also done, other type of investigations. Not much investigations are required. These are the few rarely investigations which are advised. Mostly it is a clinical diagnosis. Now we'll go for a treatment. How to treat? So don't get panic if you get a swelling like this. The treatment is from the medical treatment to the surgical treatment. Now the medical treatment, first of all, if the swelling is happening during the pregnancy, doctor might delay the doing any treatment for it, because once the woman delivers the child, this swelling might disappear, because as the hormonal effects comes down, swelling might disappear. But if it is bleeding, then doctor might take a decision of doing a treatment for that. If the patient is on chemotherapy like anti-cancer treatment, then stopping that medications can help in decreasing size. If the patient is taking anti-HIV medicines, stopping those medicines can help. Even for the acne, if retinoids are there, doctor will stop the medicines. What are the other treatment for this? Like there are the local creams available, imiquimod, applied as per the doctor's instructions. Doctor will advise you to apply over the period of time, maybe 2 weeks or 3 weeks, and slowly you can see the decreasing in size of that swelling. Second medicine is silver nitrate. Silver nitrate is a chemical type of agent which is applied over the lesion. It helps in shrinking the size of. Sometimes this pyogenic granuloma can happen near the eye area. So in that area, there is a drug called timolol. Timolol eye drops comes, which is applied in that area, which we applied as per the your eye doctor, ophthalmologist, over the period of the weeks, and then you can see it's gradually decreasing in size. Sometimes doctor might advise you to go ahead with the steroid injections in this area. Steroids will help in decreasing the inflammation and help in shrinking the size of the swelling. Now all this treatment, the next treatment is the cryotherapy, like application of the extreme cold in that area also helps in decreasing the size. All this treatment, medical treatment, there is a chance of a recurrence, like we treat it, but after like a few months it might come back. There is a recurrence rate is there with this swelling. The next treatment we will discuss is a surgical treatment. Now in surgical treatment what we do is we remove the entire swelling along with some part of the normal skin, nearby skin, and go deeper down and remove it as a complete chunk. When you remove it completely, the recurrence rate is significantly less. It's like less than 2% recurrence. So surgery is considered as a better treatment of choice for this condition. So this treatment, if you ask how it is performed, mostly it is done under local anesthesia, unless it is child and child is restless, not able to lie down properly on a bed. In that condition only the general anesthesia might be preferred. So mostly it is done under local anesthesia. Doctor will remove the entire chunk from that area. Doctor might put 1 or 2 stitches, which might be the absorbable or non-absorbable. Most of the time it will be non-absorbable stitches, and doctor will call you back later on to remove the stitches. This is the daycare procedure, so you can come to OPD, doctor will diagnose it, and if the patient is willing to undergo the procedure, same day procedure is performed and doctor will send back you home. There is no restriction of activities. After the procedure you can go back to your work or do the regular activities. Doctor might advise you not to touch that area repeatedly. Dressing will be there, but still to avoid touching that area. So this is the treatment which has been done for the pyogenic granuloma or lobular capillary hemangioma. How to prevent it? If the patient is developing the pyogenic granuloma or lobular capillary hemangioma due to the medicines like retinoids which are used for acne, better to avoid such drugs. Then maintaining a personal hygiene. There is a repeated trauma to any particular part, injury, then that should be avoided. So when you develop this condition, lobular capillary hemangioma, or as I call it as a touch me not swelling, because it bleeds whenever you touch it, don't get panic. It's not a cancer, it's a benign condition. That is, it is once you do it, it's a treatable condition. And meet the doctor once you get the swelling. If it suddenly bleeds at home, just give a pressure over that area and bleeding will stop. Go and meet the doctor, and once the doctor diagnoses, doctor will give you the correct treatment for the condition. I hope you understood this swelling, and if you have any doubts about this condition, please write in the comment box. I'll be happy to explain about. Thank you very much for watching my video.